Hey, I'm Dr. Michael with Foothills Pediatric Dentistry. We're here at the Pine Street YMCA today to talk about dental injuries. When a child injures their mouth, you probably don't need to call the dentist if the gums are bleeding or the lip is busted, but definitely call the pediatric dentist if the tooth is chipped or loose or not in the right position so that we can shoot an x-ray and do an exam to determine how serious the injuries are. There are definitely a few dental injuries that require urgent treatment. If a permanent tooth gets knocked out, it's best to immediately put the tooth back in the socket. But if you're uncomfortable with that, put it in a glass of cold milk and get to the dentist immediately so that the dentist can place a splint to allow the tooth to heal properly. If a baby tooth gets knocked out though, do not put it back in the socket because you don't want to accidentally injure the developing permanent tooth. It's only necessary to take your child to the emergency room if you're suspicious of head trauma. Some signs of that might be bleeding from the nose or ears, or if your child loses consciousness, even only for a few seconds. We can't prevent all injuries, but wearing mouth guards during contact sports helps a lot. Also, make sure to establish a relationship with a pediatric dentist early so that if your toddler has an injury, you'll know who to call.